Dear viewers, this is Kirsten Grønhaug, Senior Consultant at Østfold Hospital Trust, Norway, speaking to you about our JBJS article, Comparison of Intramedullary Nails in the Treatment of Trochanteric and Subtrochanteric Fractures, an observational study of 13,232 fractures in the Norwegian Hip Fracture Register. In the field of arthroplasty, register-based studies comparing outcomes of the various brands of similar implants in use are common and constitute an important source of information to guide treatment. In order to detect differences in complications, reoperations and survival, a large population and long follow-up is necessary, posing a challenge in designing suitable prospective studies. To answer these questions, register studies have several advantages. In fracture treatment, however, systematic surveillance of implant performance is scarce, and to the best of our knowledge, an observational study comparing long-term risk of reoperation in distinct brands of intramedullary nails has not been presented. The Norwegian Hip Fracture Register has collected data regarding primary osteosyntheses and reoperations of trochanteric and subtrochanteric fractures since 2005, providing sufficient material to conduct such a study. Our hypothesis was that there would be no significant differences, as a certain advantage or disadvantage to any particular nail design has not been documented in the literature. Surprisingly, we did find a statistically significant difference. This does not automatically imply that it is true or that it has clinical relevance. Register studies have a limited number of variables available, as data are collected prior to the study in question and can only describe associations, not causality. For instance, we did not have access to X-ray images and could not determine whether each complication was in fact directly caused by a weakness in implant design, by poor surgical technique or wrong indication. In the Norwegian Hip Fracture Register, mechanical complications are not presented in further detail than hardware failure, cutout and non-union. A reoperation due to implant-related complications may represent everything from minor events with minor consequences to complete failure and devastating consequences. Put simply, we have identified a higher reoperation rate associated with some of the implants, but at present we cannot conclude that our findings represent the truth or conclude that it is clinically relevant, despite scrutinizing the available material in search for an explanation. Our next step will be to study the failures in more detail by getting access to X-ray images and electronic patient records. Hopefully, the present study will inspire other national registers to conduct similar studies challenging our findings, as well as studies looking to explain the mechanisms behind mechanical complications leading to reoperations. Thank you for listening and taking an interest in this JBJS article.